Let's talk about some recent research integrating machine learning and geospatial technologies in a nice visual interface to understand cancer rate disparities. Most of the researchers are affiliated with the University of Chicago Medicine Comprehensive Cancer Center. The second author, though, is affiliated with the Oakland University William Beaumont School of Medicine, which is not located in Oakland, California, but located in Royal Oak, Michigan, which is a suburb of Detroit. In this research, the authors, their intention was to integrate machine learning and some more traditional statistical techniques with geospatial technologies, analyzing the data across space, and then present this. They developed they call it Intelligent Catchment Analysis Tool, iCAT, for visually representing the data and letting users perform analysis through the tool to get results. Their study area was the 5 counties that surround Chicago, so not a large study area. And they used, their data was de-identified health, demographic, socioeconomic, and environmental data against cancer rates, various different cancer rates. And they acquired this data through quality sources such as the Chicago Health Atlas and the Chicago Data Portal. As far as their methods, basically they built a system. So they built a system in, they used the R programming language. They used a couple of packages, in particular with the R programming language. They used the R Shiny package for to create easily create a nice user interface. They used the R leaflet package for the mapping, and they used the R Carrot package, which provides the artificial intelligence machine learning functionality. So primarily, the iCAT system provides a visual interface for users to perform machine learning on and more traditional statistical techniques on this data, this health data, to interactively do analysis to see are there correlations between some of the variables, also to what is the importance of certain variables to the various cancer rate. So what are their results? So because they built a system, they did not evaluate their results like what you say with metrics. So this type of research and these types of paper are becoming more common, where because they built a system, they gave their evaluation and their results through case studies. So in particular, 2 case studies. Their first case study focused on the cervical cancer mortality rate. And in this case study, they found that the neighborhood safety rate, a measure in their data for neighborhood safety, was the most critical factor affecting the mortality rates, and the somewhat distant second most critical factor in the data was a measure of female demographics. And in their second case study, they focused on the overall cancer mortality rate, and they found using machine learning linear regression that the poverty, so multivariate, they performed multivariate analysis with the machine learning, and using the machine learning, they found that the most important factor was poverty rate, and the second, a close second factor is the teen birth rate. So with all of this analysis, it's really important for those of you that know statistics to keep in mind the difference between correlation and causation. So some of I feel like with some of their, some of the different variables, there might be some overlap, and teen birth rate doesn't necessarily cause, cancer mortality rates, but it's correlated. I see 3 strengths in this paper, in this research. The first is that they really emphasized proven statistical methods and proven machine learning methods that have been shown to work consistently and produce consistent results. So they really focused on this. Second, they provided these analysis techniques in an easy-to-use interface, and they give people lots of options to perform analysis. So the combination of focus on the proven statistical techniques and giving people lots of options for analysis cuts down on the chances that some of the analysis can be wrong. So I think these are two important keys. And third of all is presenting the results in a nice visual geospatial enabled system. Really helps with one of the first things I learned in one of my statistics course is when you get your data, one thing that's really important is visualize your data, because you see patterns that visually you can really pick up on patterns. So this is the third thing that I think is really valuable outcome in the research. So as far as their contribution, I've seen quite a few papers that are taking this approach about using both statistical techniques and machine learning techniques to analyze disease data. Even myself, I did some research recently. I'm working on a paper right now that does use it, in a sense, uses kind of similar techniques to determine important factors to determine disease prevalence. I don't think this is necessarily the research is necessarily groundbreaking, but again, I feel like what their strength is that they put each of these pieces together in a nice, easy interface that has a lot of potential for uncovering patterns. And I'd say the primary limitation of the study, maybe it goes back to the data, is that they did quite a bit of processing of the data to get it into the interface. And so therefore, because of this, the current system, I don't see it too scalable. And this is actually kind of, it's shown in the fact that they only used an area of 5 counties, which is, a little bit unimpressive. So the key to extending, there is valuable contribution here, but the key to extending this research is methods to scale geographically and temporally the analysis. And perhaps one other small, limitation of this research is that they said that the iCAT system has a robust geospatial interface, but to be honest, I guess in the geospatial world, it's a little simple. Although this is understandable because these researchers really focused again on proven statistical and machine learning techniques that are going to work for health data. So I think there's a lot that could be done with the geospatial interface. So what does this research mean for business? Any research that has this potential to solve critical health problems and improve public health outcomes, obviously has a potential business application. So going back again, how can we make this happen? I would say the most critical thing is finding ways to, focusing on what you say the data scientists or data analysts, BFF, data. So making sure, finding ways to bring in the data in a clean manner and an easy manner so that the analysis can scale, and both scale geographically and temporally. In summary, this is a solid research contribution, integrating machine learning and geospatial technologies in a nice visual application that allows users to perform analysis and see results very quickly, and analyze some of the contributing factors to cancer mortality rates. So just one other note is that this manuscript, this research article, was published in the Nature publisher Scientific Reports journal, which is a really solid, long-standing solid Q1 journal. It has an H-index of 315 according to SkyMongo. So this gives these scientists' work some validation.